Good day everyone, I'm Denisa Winson. Today I'm going to present about my patient's case. First of all, I would like to derive the clinical diagnosis of this patient. First of all, I will take the history taking for my patient. So the chief complaint of this patient is on and off burning sensation on the mouth. The history of presenting illness is it is used to be less frequent, but now she finds it very annoying and she have to carefully select a diet as sour and spicy food exhibits her burning sensation in the mouth. So, the further questions I would like to ask the patient is, first of all, where is exactly the location of her pain? And then does the pain persist for several days or weeks? And do you have any other lesions in your mouth, like other than your tongue, like gums or any floor of the mouth? Is there any pain radiation, and is there any relieving factors? Is there any associated symptoms with burning sensation? Did you apply any medications on your tongue? When did the lesion first appear? And then does the lesion change in the appearance or any location in your mouth? Have you had any symptoms unrelated to the burning sensation of the mouth? Have you had a fever? What is your pain score out of 0 to 10, where 0 is no pain and 10 is most painful? Do you think any factors contributing to your burning sensation in your tongue? And does the pain goes away and reoccur after some time? Then I will proceed with the medical history of this patient. So I will ask the patient whether she have any underlying medical illness. Do you have diabetes, and are you, if diabetic, are you in insulin dependent? Do you have asthma? Do you have skin diseases like psoriasis? And do you have any joint diseases like Ritter syndrome? And do you have any atopy or allergic reactions where your immune is very low that you may develop allergic reactions? Do you have any underlying chronic inflammatory diseases like celiac disease or bowel diseases? And did you like saw any doctor, like doctor said you have vitamin D or B or zinc deficiency? Then I will proceed with the drug history. I will ask patient whether she consuming any consume oral contraceptive pills, and does she have any allergic to drugs or food or other materials. And for the dental history, the significant question I would like to ask this patient is, does your toothpaste contain additives, whitening agents or any heavy flavoring? And for the family history, I will ask the patient whether patient's family face the same problem as the patient have now. And I will ask patient like any family members have psoriasis, Ritter syndrome or any atopy or allergic diseases run in the family members. And for the social history, I would like to ask the patient about whether the patient smoke or have any anxiety or emotional stress issues. So then I'll go into the intraoral examination findings. So based on the patient's condition as shown in the photograph, the clinical findings is on the dorsum of the tongue and left part of the lateral tongue have atrophic patches surrounded by elevated keratotic margin. It varies in size, shape and have irregular border. The lesion looks like a map-like or geographic appearance. There is these squamated areas which are red, and the patient have a fissured tongue. Differential diagnosis for this patient is geographic tongue, plaque-formed lichen planus, and leukoplakia. So the positive findings I find in this patient is 20 to 29 years old. She's a female, and then there is irritation on consumption of spicy food. She has a fissured tongue, and it appears map-like geographic appearance on the dorsum and lateral surface of the tongue. And there is atrophic bare patches surrounded by elevated keratin margins, and it's red and tender and desquamated. The second is plaque-formed lichen planus. The negative findings I find in this patient is lichen planus normally affect 30 to 60 years old, and it has bilateral white lesions with associated ulcers and reticular lacy pattern for the reticular form of lichen planus. So for the leukoplakia, for the negative finding, like patient don't have any pain. Patient have pain actually, but then in leukoplakia it doesn't have any pain, and it is less frequent occur on the tongue and usually on the mandibular mucosa, and it is associated with chronic irritation from rough teeth, improper filling and tobacco smoking. And candidiasis normally like affect young infants and elderly most affected. Patches can be wiped off and there is no burning sensation on spicy food consumption. So the definitive diagnosis for this patient is geographic tongue. If in doubt, I will take biopsy. So today I'm going to reassure patient that geographic tongue is nothing harmless and nothing to worry about. So geographic tongue is a benign chronic relapsing recurring inflammatory condition affecting 1 percentage to 2.5 percentage of the population and affects 39.4% of age group of 20 to 29 years old, and there is slightly greater prediction for women than men. The etiology and pathogenesis is unknown, but there is a strong link between psoriasis, asthma, emotional stress, atrophy, Ritter syndrome to geographic tongue, and there is also association between diabetes mellitus and vitamin D, B6, B12, folic acid and zinc deficiency. It is known to be less in smokers than compared to non-smokers. The symptoms is burning sensation in related to spicy food, acidic food, and when consuming alcohol beverages. Our tongue will normally have these white pinkish bumps which we call papillae. This is a normal we found in the patients, not normal people. But in geographic tongue, there is a missing of this papillae. The tongue looks smooth, red islands appear with slightly raised borders, give a map-like geographic appearance. The thing resolves on its own but may appear at a later time and may migrate to different part of your tongue. Several factors increase the risk of the geographic tongue, which is the fissured tongue. Fissured tongue is when you have a deep grooves, fissures, which cause secondary fungal infection in the base of the fissures. So geographic tongue is totally benign. It doesn't pose a threat to your health, no complications, and good prognosis. The appearance of the tongue may be embarrassing and causing anxiety, but there are treatment options available. Geographic tongue is self-limiting and doctor may prescribe antihistamines, vitamin A, zinc supplements. You may keep your mouth clean by using mouth rinse composed of sodium bicarbonate to reduce the film present on the surface of your tongue. Apply topical steroid with antifungal agent, which is helpful in reducing symptoms. Avoid tobacco, hot, spicy, sour foods and dried foods. Maintain good oral hygiene to avoid worsening of symptoms, and avoid toothpaste with additives, whitening agents or heavy flavoring. Thank you.